Black mamba. I picked the most dangerous ones in the world: black mambas, taipans, cobras, kraits, coral snakes, rattlesnakes. I take it out and I basically let it bite my arm.
2 bites. Nice.
And the reason I do that is for shock value, to bring awareness for snakebite. I wasn't looking to be a YouTube star or anything like that, or it's all about the science for me, 100%. And when I was doing it, I sat back after about a year and just realized that people die from snakebite, and I wasn't dying. So at that point, I decided I have to reach out to every scientist on the planet.
Who would have thought that a mechanic from Wisconsin could hold the key to saving hundreds of thousands of lives worldwide? This is the extraordinary story of Tim Friede, who endured over 200 snake bites and 456 venom injections, and Dr. Jake Glanville, who transformed the sacrifice into a groundbreaking universal antivenom. Together, they created what could become the most significant breakthrough in snakebite treatment in over a century. What's up, everyone? I hope you're doing well. If you're new to the channel, my name is Chirag Lathia, and I make videos on life science and business topics. Today, we're diving into the fascinating story behind Centivax and their revolutionary universal antivenom. It's a story of unlikely collaboration between a snake enthusiast and an immunologist that could reshape how we treat one of the world's most neglected medical crises. If that sounds interesting to you, be sure to leave a like on this video. Without further ado, let's dive in. So let's start with the scope of the problem. According to the WHO, snake bites affect up to 2.7 million people annually worldwide, killing between 80,000 to 140,000 people and causing 3 times as many permanent disabilities. The current treatment system is broken. Traditional antivenoms are made by injecting snake venom into horses or sheep and then harvesting those antibodies from their blood, a process that's expensive, slow, and only effective against specific snake species. Making matters worse, several major manufacturers have actually stopped production due to low profitability, creating critical shortages in regions that need the treatment the most. So there are 2 key issues here. 1, people who experience a snake bite need to get antivenom quickly. And 2, the antivenoms that are available are usually only effective with a handful of snakes that are typically developed from the local region. People often don't know what snake they were bitten with. And so if there was a single antivenom that had more of a broad applicability, this could be extremely useful for underserved hospitals to keep on hand. Enter Tim Friede, a mechanic from Wisconsin with an extraordinary passion for snakes. Starting in 2001, Friede began an 18-year journey of self-immunization that would make medical history. He allowed himself to be bitten or injected with venom by some of the world's deadliest snakes: black mambas, king cobras, kraits, taipans, 856 times total. After nearly dying from 2 cobra bites in 2001 that left him comatose for 4 days, Friede methodically taught himself immunology and developed protocols to safely build immunity. His goal was initially personal, to protect himself while handling his extensive snake collection. But this sacrifice would prove far more valuable to humanity. Dr. Glanville, CEO of Centivax, recognized this unprecedented opportunity in Friede's unique immune history. Glanville, who previously founded and sold distributed bio to Charles River Laboratories for $104 million, had the expertise to transform Friede's antibodies into a medical breakthrough. Working with researchers at Columbia University and the NIH, the team published their findings in the journal Cell in May 2025. They created a testing panel with 19 of the WHO's most deadly snake species. So how did they do it? Step 1, they started with Tim's blood. So Tim survived snake bites, so his blood contains antibodies that have helped him. From his blood, they separated the serum for testing and the immune cells. Those immune cells contain the DNA blueprints for all of Tim's antibodies. Step 2 is to build an antibody library. So they extracted the DNA that codes for Tim's antibodies, and from there they built a library of 2 billion antibodies, basically a stored collection of his immune system's memory. This included both antibodies against snake venom and anything else that Tim had ever been exposed to. Step 3 was to use something called a phage display, which is a Nobel Prize winning method. The phage display lets scientists search through billions of antibodies to find the rare ones that bind to a specific target. Think of it as screening a giant library to find a needle in a haystack. Step 4 is to prepare the snake toxin. So they made a version of this dangerous snake toxin in the lab and they added a special tag to the toxin so it could stick to magnetic beads. Step 5 was to mix the antibody library with the toxin-coated magnetic beads. And any antibody that stuck to the toxin stayed attached and everything else was washed away. This is kind of like gold panning, where you wash away the dirt to isolate the nuggets of gold. Step 6 is to collect the antibodies that worked. So the antibodies that remained were the ones that were recognized and bound to the snake neurotoxin. At first, they tested to see what would bind with the cobra neurotoxin. And then, to find universal antibodies, they repeated the selection process with toxins from different deadly snakes, like the taipan, black mamba, and the crate. Only antibodies that worked against all 4 toxins survived this panning process. So finally, if Tim's immune system already had the broadly protective antibodies, only some would remain after this process, and those surviving antibodies would become the basis of a broad-spectrum antivenom, potentially effective against multiple snake species. And so from there, they systematically built a 3-component cocktail. 2 antibodies isolated from Friede's blood, combined with verisplatib, a small molecule toxin inhibitor. And in mouse trials, this cocktail provided full protection against 13 of the 19 deadly snake species and partial protection against the remaining 6. This represents what researchers called dramatically unparalleled breadth of protection, something never achieved before in antivenom development. Dr. Glanville estimates there's about a 600 million annual market currently fragmented across dozens of species-specific antivenoms. A single universal antivenom could capture most of this market while dramatically reducing costs and improving access in underserved regions. The next phase involves testing in dogs bitten by venomous snakes in Australia, where such incidents are pretty common in veterinary clinics. The team also plans to develop coverage for vipers, which represent another major family of venomous snakes. But the biggest challenge isn't scientific, it's economic. Glanville hopes to partner with philanthropic foundations, governments, and pharmaceutical companies to fund clinical trials and manufacturing. The goal is to make this treatment more affordable globally, especially in developing countries where snake bites cause the most devastation. So there are a couple of business lessons learned from this story. The first is that sometimes the most valuable innovations come from the most unexpected sources. Tim Friede had no medical degree, yet his unique contribution to immunology could save hundreds of thousands of lives. Another is that publishing breakthrough research openly in the journal Cell, rather than keeping it secret, can accelerate innovation and maximize global impact. Centivax chose transparency over a competitive advantage. The third is that the most profitable markets aren't always in wealthy countries. By focusing on global accessibility and multi-snake utility, Centivax could capture a larger, more sustainable market while creating tremendous social value and patching together what was a fractured market. The last is that sometimes you need to step back and let the right expertise lead. Just as John Adams brought in OTC specialists for Mucinex, Friede became director of herpetology at Centivax, contributing his unique knowledge to the scientific team. So to summarize, if successful, this universal antivenom could revolutionize snakebite treatment globally. Instead of requiring species identification and maintaining inventories of multiple antivenoms, hospitals could stock a single product effective against most deadly snakes. This could be really transformative in rural areas of Africa, Asia, and Latin America, where snake bites are common but treatment is the least accessible. With that said, let's get a discussion going in the comments below. What do you think about this incredible story of Centivax's universal antivenom? Would you like to see more videos about breakthrough medical innovations? I'll read all your comments and reply. Please also consider sharing this video and subscribing if you learned something new. Thank you so much for watching, and I'll see you in the next one.